and death, literally. To understand why a nail is such a powerful diagnostic tool, you need to understand what it actually is. The nail plate, the hard surface you see, forms inside the matrix. The matrix is a tiny zone of living tissue tucked under the skin at the base of your finger, just beneath the cuticle. It is extraordinarily sensitive to everything happening in your body. Any disruption in metabolism, any nutritional deficiency, any inflammatory process, and it shows up in what the matrix produces. The plate changes color, shape, texture, and growth rate. It records your health history the way a black box records a flight. A full nail replacement takes 4 to 6 months on average. That means right now, on your hands, you are carrying a 6-month archive of what your body has been through. Every ridge, every spot, every shift in color is an entry. The only question is whether you know how to read it. 90% of the nail plate is made of keratin, a structural protein, the same one that makes up your hair. But the architecture is entirely different. In a nail, keratin fibers are stacked in layers, like sheets of plywood, bonded together by sulfur bridges. Those sulfur bridges are what make the nail hard. Hair lacks them, which is why hair bends and nails do not. This also means sulfur is critical for nail integrity. If your diet is low in sulfur-containing foods, eggs, garlic, cabbage, the layers begin to separate. Splitting and peeling are the surface sign. But underneath that surface, the mechanism can be pointing to something far more serious than a diet problem. Between those keratin layers sit microscopic films of fat and water. They are what give a healthy nail its faint gloss and smooth feel. When the body is chronically dehydrated, and as we age, the thirst mechanism becomes less reliable, meaning people routinely drink less than they need without knowing it, those films thin out. The surface turns dull, develops microcracks, loses flexibility. Most people blame winter or hand washing. The real cause is often sitting in a glass they are not filling often enough. Beneath the nail plate lies the nail bed, a thin layer of tissue threaded through with capillaries. Blood shows through it, giving a healthy nail its pinkish tone. The composition of that blood, the oxygen level in it, the concentration of hemoglobin, all of it is visible right there on your fingertip. Hemoglobin drops, the pink fades toward white. Oxygen falls, blue-gray creeps in. Bilirubin rises, yellow appears. Bilirubin is the breakdown product of red blood cells, and when it accumulates, it means the liver is struggling to clear it. 10 small screens at the ends of your fingers are broadcasting your body's internal state in real time. Most people do not look. Now back to those white spots. The medical term is leukonychia, white nail. What you are actually seeing are microscopic air bubbles trapped between keratin layers during formation. Air, not calcium. Where do the bubbles come from? Almost always from microtrauma. You hit your finger on a table edge. You pushed the cuticle back too aggressively. You worked in the garden without gloves. The matrix took a small hit. The layers formed unevenly. 3 to 4 months later, exactly how long it takes for that spot to grow visible, you notice it and start worrying. The cause is long forgotten. But not all white marks on nails are harmless. If what you see is not isolated dots, but horizontal white bands running all the way across the nail, and you see them on several fingers at once, that is a different story entirely. Those bands were first described by a 19th century Italian physician named Merca. They are called Merca's lines. They can indicate heavy metal poisoning, chronic kidney disease, or severe protein deficiency. The difference between a harmless white dot and a diagnostic white band is like the difference between a scratch on your car and a crack in the engine block. They look vaguely similar from a distance. The consequences are nothing alike. If the entire plate has turned uniformly white, milky, opaque, with no pink showing through at all, that finding is associated with serious liver dysfunction. When the liver is failing, certain proteins accumulate in the blood and the vascular pattern beneath the nail plate changes. The pink disappears. In clinical textbooks, this is described as one of the classic early signs of cirrhosis, the kind of sign that appears long before jaundice sets in or pain begins. The nail signals first. Now, look at the base of your nail. Do you see a white crescent? That is the lunula, and most people ignore it completely. It is the visible portion of the matrix, the growth zone. In a healthy adult, it is clearly visible on the thumbs and faintly visible on the other fingers. If it has disappeared entirely from all of your fingers, that can point to anemia, low red blood cell count, nutritional deficiency in the peripheral tissues, or a thyroid problem, specifically a sluggish thyroid. The opposite finding, when the lunula takes up more than a third of the plate, a condition called macrolunula, is associated with an overactive thyroid. One small crescent, two opposite diagnoses. The same landmark pointing in completely different clinical directions depending on what you see. A bluish lunula is a rare but serious finding. It indicates excess copper accumulation in the body, a hereditary metabolic disorder called Wilson's disease. Without treatment, Wilson's disease destroys the liver and the brain. The first signal is quiet, sitting right there at the base of your fingernail. A red lunula points toward autoimmune processes, chronic heart failure, or carbon monoxide poisoning. Think of each shade as a warning light on a dashboard. Different colors, different systems, different urgency levels. Each one requires its own response. Now let us look at the color of the entire plate. A healthy nail is pink, smooth, and faintly shiny. Any deviation is a message. Let us read those messages one by one. Yellow nails are the most common complaint I hear from patients over 50. The first cause is fungal infection, onychomycosis. Organisms get under the free edge, break down keratin, and